Very much. All right. Again, I'm Lee Bewley. I currently serve as the program director of our MSHA program. I also have the honor of being the regent for the Kentucky chapter of the American College of Healthcare Executives. The American College of Healthcare Executives, ACHE, is the professional organization representing health administrators, health leaders across many industries in healthcare, hospital, health systems, medical practices, medical logistics, entrepreneurs, the whole round. And so we organize those activities here in the state of Kentucky. We maintain those ties with the American College of Healthcare Executives for a few reasons. One is to make sure that what we cover in our competency-based curriculum here at U of L MSHA is aligned with the expectations of employers now and for the foreseeable future. But we also have a line of connection with ACHE and the professional organizations to ensure that there's networking and developmental opportunities for our students during the program, and then beyond the program as they move into their careers, to maintain the skills and abilities that developed in the program and strive towards being board certified, to be a board certified healthcare executive, a fellow in the American College of Healthcare Executives, sends that signal of quality and also as a mark for roles of more senior leadership roles and positions. Okay. Let me dive into our information session, and I'll open the floor to close for any questions that you may have. All right, so starting off in general, like why health administration and is a discipline, and what are the roles or opportunities for value generation, to organizations, but also in your career? Well, we'll start first that nearly 1/5 of the national economy of the United States is dedicated to healthcare. A couple of $1 trillion of expenditures. But here's the thing. In spite of spending so many dollars, literally a couple of trillion on healthcare, there are lags that we have as a society and as a health system in terms of outcomes. And so it's not that things are terribly bad, but it could be so much better. And so at a very basic level, why health administration? Well, the role of health administrators are to take the resources that we have within our organization, whether or not it's a group practice or a hospital or health system or medical logistics, and to use those resources most efficiently and effectively. And so if we do that, we can have more successful organizational outcomes. Our company can be more profitable, or that we stay within budget. But societally, in terms of how we serve our community, is that we use those resources to the greatest effect to be able to achieve levels of not only efficiency and effectiveness, but we may be able to have more equity in terms of ensuring that all of the members of our community, all the members of our society have appropriate access, and which creates, of course, a higher level of health. Look, another perspective from a career consideration is that a median healthcare manager in America earns about $118,000. That's not to say that you immediately after graduating from the program, you're going to jump to 118. But that median salary means that there is a opportunity to earn substantial income to provide for yourself and your family. And then as you rise to even higher levels beyond a director to being a vice president or being a CEO or healthcare executive, that there is a very high ceiling, but also a relatively high floor noted, but there's a 29% growth rate expected in the next several years in roles of health administrator. A few key points about our discipline, health administration, and why a career in healthcare management and having this master's in science health administration are important. One is that from a forward-looking perspective, touching on that efficiency and effectiveness and by extension equity, is that we need to have an opportunity to focus on population health management, taking the resources that we naturally and normally receive in terms of income received through traditional revenue, fee for service, but also thinking about perspectives of third-party payers, Medicare programs, Medicaid, all of those resources need and require us to have a population health management perspective where we meet our organizational goals, but we serve our community in a way that leads to higher levels of health rather than avoiding the olden days of basically episodic care. Saving a life, treating someone for an injury or a sickness isn't, of course, important, but what can we do to elevate levels of health? To get there, we're going to have to understand new financial models, the way that we manage financial resources in terms of the balance of risk, of who's paying, who's receiving the services, what is the role of the health administration team and managing resources in terms of payers and recipients. And finding that new value-based perspective as part of your competency set is critical. Extended is that you need to know how the information that we have in either a predictive way or a retrospective analysis is used to drive decisions in terms of how we organize our health services and incorporate the patient as well, and as well as levels of health in the community. And then the bottom line is that we're in the people business. We work with people to serve people and communities. And so there are three basic things that can happen in a leadership situation, and individually or collectively. People can be resistant, they can be compliant, or they can be committed. We judge that those people that are able to develop leadership competencies that have a clear understanding and a knowledge of health administration, that work well with people and can explain and guide the way forward, are more likely to earn commitment. And so we aim to develop leadership that is commitment oriented and even more so committed to communities and to people. All right, I'm not going to go through all the roles, but the practice of management, particularly in healthcare, is planning, organizing, leading, and controlling the operations of an organization. Graduates of our program can work across all of the elements of health and healthcare delivery, and the type of roles can range anywhere from the operational level, managers, coordinators, analysts, or specialists, to a vice president, director, and then ultimately through career advancement. To the extent that you have goals and aspirations, do you want to serve as a CEO, president, or be an owner or partner of a healthcare organization? This program develops those competencies that you can be an effective organizational leader. You take what you bring to the program, and it's not a clear slate. We realize that students come in with a certain set of skills and abilities, and we want to build upon that foundation to get you to the levels in order to be able to serve at roles commensurate with which, one part, your aptitude and your aspirations, but the other part, the appropriate level of training and development, and then feedback and evaluation. All right, we have a great basis for health education and health administration, specifically here in the Louisville area. We have a number of major healthcare organizations and health systems. There's some entrepreneurship here. We have a medical school and a academic health system, and a number of major partners such as Norton Healthcare and Baptist Health System, Federal Healthcare. This is a great place and a learning lab, and also a great place to work in healthcare to be able to have a thriving career. We draw upon the healthcare systems and resources, in terms of some of our problems and some of the activities that we have in our learning exercises. We have a number of colleagues that are part-time lecturers and our adjunct faculty that we draw from the executive ranks. And of course, a number of our students and alumni work in this area. And so it makes Louisville, Kentucky a great health center hub to be able to grow and develop, and then to career plan as appropriate for those folks that want to stay in the Louisville metropolitan area to serve. But we have impact and we have career placement all around the country and the world as well. So I did note our grads, we're constantly updating this list, and in some cases some of our graphics are going to get so small that we're going to have to take a sample set. But we have a number of students recently that have been accepted for administrative fellowships across the country. We have a number of federal, military healthcare, federal healthcare, and folks that come to Kentucky or come to our program and serve either within the region or across the country, and in some cases the world. We have one of our current students, when I meet with them today, it's tomorrow. He's a physician assistant in a National Oceanic Authority clinic down in Antarctica, so it's sort of a cool perspective and it's a cool reach, literally and figuratively. All right, how do we guide our program, and what do you see here? It's our judgment to be a leader in serving people. You must operate with honor, integrity, and professionalism. And so we aim to model those ideals, our faculty, our staff, our department, and so that when you come to the program, that you see a professional Master's of Science Health Administration program, that we take those ideals and we commit them in class, but we also, when we engage with the American College of Healthcare Executives and members of our team, we have a mindset that we're building leaders, leaders who can competently serve. It's not enough, there's an old saying about make it, fake it till you make it. We don't subscribe to that. There's too much risk when you're serving people and families and communities. We want folks who are competent, that can take leadership roles and take authority and responsibility and to successfully manage the requirements of the role to have great effects. And so honor, integrity, professionalism, we aim to model it, and we aim to be able to instill it in our graduates, to serve families and communities and to pave the way, for the next generation of healthcare leaders in our country and our communities. All right, a couple of, I don't want to break our arm patting ourselves on the back, but we have some really great standing in the community. Our School of Public Health and Information Sciences is CEF accredited. Our Master's in Science Health Administration program is CAHME accredited, and so that dual perspective of CEF accreditation and CAHME accreditation is positively distinctive. Currently our program is the 46th ranked accredited program in the United States. There's a number of programs in health administration across the country. Not all are accredited. 46 is a great place to be. We're always aiming to be higher. We judge that our students are our best credentials, and so when they win case study competitions or go out and they're selected for fellowships, or our colleagues, print a great research article or have a service opportunity, we make sure that to remind the folks. And so we're 46 now, and we're aiming even higher. But to graduate from our program has the quality standing of both CEF accreditation and CAHME as well. How about our curriculum? So currently, we are recruiting students for the foreseeable future for the online Master's in Science Health Administration. We have 15 courses that are required in the MSHA program. 14 of those courses are 3 credit hour classes. We have a single 1 credit hour seminar. And so over the course of a normal academic year, all of the courses of our MSHA program will be offered. And so the normal track is that most students graduate in a 2-year period, and they take some combination of courses, 1 or 2 each of the 8-week terms. We offer these 8-week terms for working professionals to be able to focus on 1 or 2 or potentially 3 courses at a time in an 8-week period, and then move on to the next 8-week. All of our students matriculate in the fall semester, and so fall 1 is from August through the first part of October, and fall 2 is from the second week of October through the first week of December. Similarly, in spring, we start in early January, usually the second week of January. Spring 2 begins in the next week, that second week of March, and ends here around Kentucky. We call it Done by Derby. Kentucky Derby is always the first Saturday of May, and so usually the University of Louisville spring semester ends before Derby. Then in the summer, we have an 8-week term that is basically the month of June and July. Where are there breaks in the online MSHA? There is a break between fall 2 and spring 1. Basically, most of December and the first week of January, we don't have classes. There is a break between spring 2 and summer, so about 3 weeks of the month of May, the second, third, and fourth week of May, there are no classes. And then at the end of summer, usually the summer 8-week term ends at the end of July, and so there's 2 or 3 weeks before classes start in August. And so that is the pathway. I note in fall 2 that there is a PHMS 690 for graduating students. There is a pathway that if a student takes a combination of 2 or 3 credits, or maybe an extended part-time, that they may want to graduate in the fall of a particular semester. So we offer that 690 course by exception in the fall, so that students can graduate in the fall, or they can graduate in the summer. All right. We also have 3 graduate certificate programs: the Healthcare Management Certificate, the Healthcare Financial Management Certificate, and the Healthcare Quality and Project Management Certificate. Those 3 certificates are created, they're directly drawn from our MSHA curriculum. That is to say that students that are in any one of those certificate programs will be co-enrolled with our online MSHA students. So who would seek the graduate certificate? Perhaps you have a new role or a job or an opportunity where you just want this particular development, either basic healthcare management or financial management, or maybe quality and project management. If so, you may only want to take that certificate program, earn the certificate, and then incorporate that into your work and your current job roles. Could be that a student might want to come back, they already have a master's degree and they want to have continuing education development. They would pursue that certificate. But here's the thing. If a student completes any one of the certificate programs and they earn an A or B in each of those courses, within a 5-year period, those credits earned in the graduate certificate can be transferred over to the MSHA and count towards credit. Certificate admission and MSHA certificate are two separate actions, and so if you simply want to apply to the MSHA, apply to the MSHA. If you want to apply for one or more of the graduate certificates, apply for those individually. If you have any questions about this, I'm happy to answer it, or you can contact our program coordinator or our admissions coordinator as well. Let me just say this as a bit of general guidance as a professor, but also as a healthcare executive. If you think that you want to take the full MSHA, I wouldn't even pursue the certificates. Having a CAHME accredited MSHA is credential enough. But on the other hand, if you wanted to try it and maybe take one of the certificates, and if this is the kind of content that you want to pursue, I see that pathway, earn a certificate and then transitioned over to the full MSHA. But once you earn the full MSHA, those graduate certificates, the lead credential will be the degree. But I'm happy to work through that. Of course, we want to serve students, and if that's, depending upon your goals, or your timelines, there could be a different set of combinations. But all of the graduate certificate courses that we have are co-enrolled with our MSHA program and follow the same schedule. All right, a couple of program highlights. We're very active with the American College of Healthcare Executives, both at the state and national level. State level has a number of networking opportunities and continuing education development literally across the state of Kentucky. I have been in Western Kentucky, down in Paducah just a few weeks ago for a session. There's often events here in Louisville or in Lexington, and then we would go out to Appalachia Regional Health and some of our partners out in Eastern Kentucky. And so all across the state during the year, we will have continuing education development and networking opportunities. And so in most all occasions, students that are enrolled in our program have free admission to these events, and so they can have the benefit of continuing education development, but also the benefit of networking and professional development in our community. Kentucky ACHE and National ACHE support graduate students' attendance at the annual Congress. That's an annual conference. This year it's going to be held in March in Houston, Texas. And so what I say that is there's sponsorship opportunities where the Kentucky ACHE will provide some travel dollars, a few $100s, that it either can cover registration or a flight or travel down or lodging. And similarly, National ACHE will provide students opportunities to volunteer for 2 or 3 hours of service to have their registration fee covered. Looking out to 2027 in March, I think the year following is that the National Conference for ACHE is going to be held in Nashville, so a little closer to home. Our students compete in case study competitions and graduate essay contests. We love it. We support it. If there's any travel or registration involved for these case study competitions, or if a student has a graduate essay win, show, or place, we cover those costs directly. We want our students to take an achievement orientation, but also to get out there and to interact with students from other programs. And almost in all cases, the judges of these case study competitions are healthcare executives, which can also help with your networking and to get direct feedback. It's also a way for us to market and promote the program. When our students do well, it reflects on our rankings, and it also helps alumni and students to show our reputation. Just recently, we had a team that consisted of online MSHA students from El Paso, Texas, Fort Bliss, Frankfort, Kentucky, and Louisville, Kentucky, that attended the National Association of Health Service Executives Case Study Competition and Conference in Pittsburgh. They did excellent. And then we had another team, and just a week later, that were semifinalists on a virtual case study competition with the Penn State Case Study Competition team. And so we've had teams that were finalists, semifinalists. We had a student that won, came in first place in the Stoll Graduate Essay Contest with the American College of Healthcare Executives. So we can get more into that, but we want our folks to go out and to compete, to be able to, and oh, by the way, when you compete, if you win any prize money or scholarship money, all that comes to you. But if there's any expenses, the program will cover that. Because our program is CAHME accredited, graduates of our program can pursue administrative fellowships either within the Kentucky area or across the country. Mayo Clinic, you may have seen, Kaiser Permanente, you may have seen that there was a Sutter Health listed. One of our students was selected just a couple years ago to Sutter Health System in California. And we've had placements at the Medical University of South Carolina's health system recently as well, and then everywhere in between. Our faculty are doctorally educated, are former healthcare executives. Some are board, myself, I'm a board certified healthcare executive. We have executives in residence. We have a former chief medical officer of one of the healthcare systems here in Louisville, and we have a gentleman who is a longstanding healthcare executive at University of Louisville Hospital and Kentucky One Health as a director of population health that serves as an executive in residence for student advising, counseling, networking. We aim to be able to provide those support services. We are CAHME accredited, and we are a member of the Association of University Programs of Health Administration, so we want to be connected, to maintain a national standing and reputation. Again, 8-week terms for our online courses in MSHA. We take these 8-week concentrated terms so that our students can focus on the content over an 8-week period, complete the work, and then move on to the next 8-week period. And so we also say that students can either tap on the brakes or tap on the gas as necessary. If you want to take more courses in a particular term, you can take up to 3. In some cases requires, if there's an overload status, you may have to ask permission, but as long as your grades are good and you have a demonstrated record, you can take up to 3 courses per term. Or it could be that one term that you have 0 classes. You have a lot of things going on in your life, whether or not it's medical, social, professional, or you may have a professional. You're going to have a lot of travel. You're a military service member, you could be deployed or away. The choices for enrollment in any one of those 8-week terms could be 0, 1, 2, or 3. All right, I'm going to close out and open up for any questions folks have. Again, that's lee.bewley@louisville.edu. They got the QR code if you want to use to, request additional information. The Director of Student Recruitment in our school is Ms. Deepti Chain, and our admissions counselor is Jennifer McLean. Also, I need to update this slide. Mr. Brian Mathis is currently serving as our program coordinator and is a great resource for perspective and then, of course, by extension, future students. We admit students throughout the year, so we don't sit on applications. If you apply to our program and we have all of your documentation all the way up to July 1st, or you have your application in by July 1st, you will be evaluated as your admissions packet comes in, and we can provide you that feedback to convey your admission status in usually within 2 or 3 week period. Sometimes it can be a bit sooner there as the hourglass of the admission season gets down. We can be a little quicker, but usually 2 to 3 weeks you'll know your admission status. And what are we looking for? The bottom line is we're looking for someone who has both the aptitude and a clear interest in graduating from a CAHME accredited MSHA program. And so we have a 3.0 GPA standard. If you have greater than 3.0 or higher, no issues, from a regionally accredited institution. If you have a GPA between 2.5 and 2.99, you can still be admitted to the program on a conditional basis, and the conditional basis be that within your first enrollment, usually the first 9 credit hours, that you earn a 3.0 or higher. If so, you're fine, you're good. In the event that you were admitted on a conditional basis and didn't earn a 3.0, then generally speaking, then that conditional admission is withdrawn. If a student has a graduate, a bachelor's degree, and like in the 2.0 to 2.49, you can still apply to the program, but it would require extraordinary justification, life circumstances, career goals, perhaps a record of like maybe a few graduate courses that you have taken. And so if you have any questions about your admission status or viability, please ask us. We're happy to address each of the questions. So we'll need transcripts. We need a brief 1-page letter, statement of purpose, like what do you seek to gain from this MSHA? How does the degree program fit in your life and career goals? 3 letters of recommendation. It could either be a simple letter or memorandum, or I think the graduate school site has some forms that you can share with someone who would provide that reference, a supervisor or a colleague. We also need a resume, and then of course, your transcripts and any other additional information. All right, that concludes what I wanted to present. I will close out the slide set and open this session to any questions you have that you could either raise your hand or you could type your question into the chat box. But we have at least 5 minutes or so to answer any questions. So what do you have? I am mindful that in a professor mode, I put a lot out there in just a short period of time. So maybe you might be absorbing that information. But I will say again that this session is recorded if you want to go back and review. Rania, I see your hand is up. I'm happy to answer your question.
Thank you. I'm currently a pulmonary fellow at University of Louisville, and I was hoping to take this master. So I noticed that you cannot like apply for it in the spring, but I was wondering if I could take like some of the courses, maybe through a certificate, just this spring.
So here's the thing, brass tacks of the matter. Yes, but what we would do is there's paperwork, and maybe Brian actually can help with this. Welcome, Brian. I don't mean to like put you right on the stage. There is a way that you could, with permission, we could have you enroll in a class as a non-degree seeking student. Let me just say this. You might, in the long run, want to earn the degree, but the way that the university would consider you taking a specific course in the curriculum would be to be in a non-degree seeking status. You would, of course, it would count as an admission, not an admission, it would count as an enrollment and whatever tuition and fees, you would pay that, of course. But the credit that you earned would be applicable that when you did become formally admitted into a certificate program or the full degree program. So does that answer your question? Yes, it's possible. Yeah. It requires coordination.
Mm-hmm. Okay, and then from understanding if you're enrolled in every semester, you can finish it over 1 year, correct?
It would take about 17 months. And let me just explain. I'm happy to answer this question. All of the courses are available in an academic year. Currently, the graduate school and the School of Public Health have admission standards for new graduate students. Is that the maximum number of students that a student can take normally as a graduate is 12 credit hours. If you check the math in a regular semester, a fall semester or a spring semester, in order to take 3 courses per 8-week term, in the spring semester, that would take you very nearly 18 credits, which requires special permission overload. So what the deans the School of Public Health and the dean of the graduate school said is that if in the spring semester a student takes a normal load, which would be about 12 or 13 credit hours, and they have a 3.5 to 4.0 GPA, then we will allow them to take overload status, which would be taking 3 courses each of those 8-week terms. That's why we offer that PHMS 690 course as needed in the fall, is that a student could take 13 credit hours in the spring, do well, get a 3.5 to 4.0, ask for permission to take an overload in the spring. And if that's approved, then you can take the 3 and 3, which would be 18 hours in the spring, take a normal summer of what would be 6 credit hours, and then in the fall, take those last 2 courses and graduate. So the fastest completion that a student can have for our MSHA program is 17 months. So you would matriculate in August, take a regular normal University of Louisville graduate student load in that first fall, do well, take an overload in the spring, take a regular amount of 6 hours in the summer, and then in the second fall, you would have 6 hours. You would take the courses that you didn't take in the first fall, and it would culminate, of course, with the capstone. So 17 months is the fastest pathway to earn an MSHA. Now, let me just say this. There could be a special circumstance. I'm just talking out loud here for a second, but we can get into more detail with any individual. But depending on perhaps which course you took a person who took in special status, or if they came in with credits. That's another. If someone graduated from, I guess that's a key point. If a student has graduated from a CAHME accredited undergraduate or master's degree program, then there is one of the courses that is not required. You can be exempted. There's a PHMS 520 Introduction to Public Health for Health Administrators class. If you've graduated from a CAHME accredited program, you don't need to take that class, which could also expedite potential graduation. And then finally, there's a, again, case-by-case basis. If someone has attended another health administration program or a business administration program that has coursework that is very closely aligned with required courses, up to 6 credit hours, we can take transfer credits as well. And so again, case-by-case basis. So accepting out extraordinary cases, when I say extraordinary, not one in a million, but like something a little bit different, bringing prior credit in or prior experience, the fast path, the rocket cardinal approach is 17 months. Regular cardinal, it's usually about 2 years.
Okay.
All right, great question. Thank you, ma'am.
Thank you.
All right, any additional questions? Okay. Well, let me say this. It's 12:32. We're at the bottom of the hour, a little bit overtime, but it's okay. Any questions that you have about our program, I'm always happy to answer about the admissions process. You've got the contacts for Deepti and for Jennifer as well. You know, you might work your way to Brian, our program coordinator, but we're looking to grow the program. We have time. We're sitting here in December. Thank you, Brian. I appreciate it. Brian added his email there in the chat. It's December 10th. We take admissions applications all the way through July 1st. And so there's some time. We appreciate you spending some time with us. In the absence of and respect for everyone's time, we'll close out this session. It's a recorded session. I hope you and your families have a wonderful holiday season and even better new year ahead. You all take care, go Cards, and if I can do anything to help, please let me know.
All right, thank you.
You're welcome.